Perfect. Good afternoon, everyone. Thank you so much for having us today. My name's Holly. I'm a paediatric nurse by background, but at the moment I'm working as the Associate Chief Nursing Information Officer across the NHS Transformation Directorate. And we were really excited today actually to be invited along to share some of the work that we're doing around what good looks like. And also as I'll let Tracey introduce herself afterwards, but hopefully we'll link quite nicely together and we'll paint a bit of a picture as to how we're using some evidence to support QI, but hopefully also supporting yourselves and other organisations on the front line as well. Next slide, please, Donna. Thank you. So, in terms of setting the scene, now, What Good Looks Like was a parent programme that was established a couple of years ago now as COVID was really coming to fruition, and I'm sure you've touched on this morning, but what we've seen throughout this period of unrest and kind of really unexpected turn of events is a fantastic fast-paced escalation of innovation in this digital tech field. It was great actually to hear some of your conversation towards the end there around remote monitoring, virtual access to services. And this really prompts the question around actually how can we support transformation across the system, but also what does it mean for our clinicians and other professions as well. So as I mentioned before, we work across the nursing team, and what we were really hearing is that nurses are really the largest profession in the NHS. They deliver the predominant volume of patient contact, so they really are delivering that hands-on care. And as a result of that, actually handle the most technology and data within the NHS. And so we were really wanting to look at what we would need to do to support clinicians, not only nurses, midwives as well, and our other clinical colleagues, to have a voice that's really pushing at the forefront of this improvement. What we could see was that this is really an emerging specialty, and whilst some organisations have been doing this for 10, 15 years, and some specialists have also been doing this for a significant period of time, actually a lot of the system was becoming woke to the idea of digital. So we saw that actually skills and experience in this area was very varied. The positions that were available in organisations, again, were really varied, both in terms of where these roles sat within an organisation. Did these clinical roles fall within the IT sector? Did they fall within the Director of Medicine or into the Chief Nurse? We also found that between different organisations, there was really varying practice and a disparity in where we were in terms of digital maturity. And that in turn was then potentially inhibiting our ability to be able to innovate and to research using digital technology to support practice. Next slide, please, Donna. Thank you. So this just gives you an overview of the parent framework, and we say parent framework, this is the overarching What Good Looks Like programme, and we then really focused in on nursing and we've produced subsequent guidance recently. But this entire piece of work was really around looking at what support is needed across the system. We've got a bit of a feeling for that evidence. We know what some of the biggest health risks are, but how can we help organisations and ICSs to transform, digitise and connect to improve patient outcomes, to improve the experience of people accessing our services, and also most importantly to improve the safety of the care that we can deliver. Next slide, please. Thank you. So from a nursing perspective, this had a lot of similarities that were aligned, but this was really about helping our chief nurses and also chief nursing information officers, or those nurses working in digital, to understand what this guidance means for them in their position, but also the importance of engaging the nursing workforce to help to uplift and upskill and move together. When we think of well-led, this is about looking at how we can start to influence strategy. And again, this is really about the wider multidisciplinary team. I think we all know from working on the front line that actually when a piece of guidance comes in, it's sometimes slightly unclear as to, what does this actually mean for us and how can we help to drive this forward. It's also about getting that wall-to-wall connect. So how can we make sure that we're supporting our frontline clinicians and nurses to be really pulled into engaging in that strategy? How can we make sure that we're creating the right services for our patients who are accessing them every day? When we're thinking of ensuring smart foundations, we're looking at how we can start to align services across the board, the language that we use, for example, through digital technology. How can we start to align some of that so that we can pull that data through in a way that is then more impactful as we move forward for the system? Now, I won't talk you through each of these with those time restraints, but we will share the guidance with you afterwards. And I think ultimately it ties back into some of the conversation that was had before, and this is really around how do we connect the system to share best practice, to uplift together, to provide better, safer care. And you'll see that the 7th success measure, healthy populations, actually once we've got this foundation of leadership, once we've got this foundation of great collaboration across the system, once we've ensured that tech is there to support us, we are there to support tech, that we've educated our workforce, actually how can we drive this forward to really influence population health? How can we engage and hope to better those inequality measures that we see now? Next slide, please, Anna. Thank you so much. So just briefly, this guidance was really written with nurses and clinicians in mind, and really in partnership as well. There was a significant consultation period, and once the guidance was launched on March 15th of this year at a Digital Nurse Summit, this was really around socialising the guidance. But what we've learned through a brief period of discovery in the interim there is that actually the focus now is about encouraging adoption. So what can we do from a central perspective to help to support that quality improvement cycle that's really going to be taking place within your organisations? Next slide, please, Donna. Thank you. Now, I'd like to pull this back almost the QI perspective, because I think it's important that we can see how it's embedded within the day. And when we think of different hospitals, I always like to think of it as space. So we've got the university, we have our wider system, that's health and care overall, the NHS is the system. We then have our own ICS, and they have several different health and care settings within there. And our hospital itself, our own organisation, is a system built up of small microsystems that all influence one another, have impact, and are also susceptible to those wider environmental impacts as well. When we look at policy that comes from a national level, we're really identifying the problem there. So this could be something such as COVID that comes in with a big splash, or actually it could be the recognition that there's an ongoing problem and we need to solve it. When we think of standards, that's a breakdown of specific requirements and quantifiable measures. So in terms of your work that you do, it's again great to hear that clinical aspect. Actually, standards, what are the standards of care you've got here? How are we going to break that down? Guidelines comes in next. So what good looks like, both the parent programme and the nursing programme, is the guidelines, so providing recommendations and most importantly giving a sense of what best practice looks like. And then we get to strategy. Now, I like to think of strategy as a holistic action plan. Strategy is something that should be owned by those who are most impacted by it. And I think when it comes to national policy and strategy, yes, our patients are the overall receivers, but actually our frontline clinicians are really those people who are going to help us to carry this through to action and to bring this to fruition. When we're thinking of quality improvement, this would mean in our own organisation to identify what our biggest problems are. So that could look like a gap analysis tool, for example, with the 7 success measures. What's going super fantastically in your organisation, and where are the areas that are the real pinch points or could use additional support? We've then got a series of support tools which I'll go on to shortly, but they should start to influence that. So once you've identified where you are in terms of what good looks like, actually what do you need to recognise as your biggest priorities? How can you think of getting there? Is that continuous dynamic evaluation and that continuous cycle of quality improvement. But when it comes to taking national policy and guidelines and bringing it to strategy, it's also recognising the fantastic insight that you're able to bring to that for your organisation, influencing that as well. Next slide, please, Anna. Thank you so much. So just in terms of a current support offering, if you're more interested in finding out some more information, we have a number of different facilities available. So again, echoing one of the fantastic points that in the room was brought up earlier, actually, how do we share best practice? we're all trying to achieve the same thing across the system, aren't we? We're all trying to achieve safer care. We want to be able to research, to innovate. We can see that there are snippets of fantastic digital practice going on. How can we make sure that we're not all making the same mistakes, that we're not all reinventing the wheel, that we can accelerate at pace, and that we can travel on this journey together? We have a future site, which I'll share the QR code with, and I'll share these slides with Donna as well, so they can be circulated afterwards. But there's essentially a hub which pulls together some examples of that best practice, illustrated in different ways. We have case studies and blueprints, which are a recipe book for you to pick up and take and to learn from. We have snippets, which work as audible podcasts, where it highlights some key areas of innovation in this area and really has a vast perspective, I suppose, from different health and care settings across the system. There's illustrated guidance, gap analysis tools, and also a series of webinars and masterclasses. Now, I mentioned before that we're in our discovery phase. We're on our own quality improvement journey here. We've identified the problem, we've made a plan, which is the guidance, and now we've done a bit of discovery and we're figuring out how to execute this and to help organisations to adopt this in the best way possible. So there's definitely more to be coming to this soon, and we will keep you in the loop. If Donna just clicks onto the final slide, there is a QR code on there, which again will be distributed afterwards. But this will take you through to that futures page. This will have some more information on there for you, ways to be involved in the future, additional resources and recordings as well. I know we've got a couple of minutes left till we pass on to Tracey, so really happy to take any questions or to pass straight on to Tracey as well, which will lead on quite nicely.
Thank you, Holly, that's great. Shall we jump straight on to Tracey and then we can loop back around to questions as a whole, which would be...
Yeah, I'm happy with that. Don't know if you wouldn't mind doing the slides. I think I'm before Holly, 53. So I've actually left Judith Dando's name on here because she's the programme manager, and we're doing a real double act on this to make sure that we're programme ready and nurse ready. So I'm Tracey Eyre, I'm the programme lead for nursing in the Digital Readiness Education team at Health Education England, and I'm also a member of Natasha's team. My history actually, Roy, we've met before. We met pre-COVID at Newcastle Hospitals with Dame Jackie Daniels.
I came up for the day, I remember.
You did, yeah.
I had a terrific day, yes.
We did a tour of, my background is I was in a digital health team, clinical informatics, for 12 years, so I took a trust from being totally on paper to electronic, and I was also the lead for the digitisation of Nightingale Hospital North East. So I've got a background in this, but my passion is education, so last year I moved into this role. If you could go to the next slide, please. So I'll tell you a little bit more as we're going on about the Phillips Eyes review, but our chair and our commissioner for this is Dr. Natasha Phillips, who I'm sure many of you know. The international vice chair is Jeanette Ives Eriksson. Now Jeanette is chief nurse emeritus at Mass General in Boston. She spent more than 20 years in that post, and she's an instructor at both medical schools and nursing schools. She's currently she keeps trying to retire, but we've pulled her back into this, and she's also currently a CEO at the Nantucket Hospital, and incidentally led the COVID hospital in Boston, and unfortunately they're still having huge issues. So we're amazed that she's managing to put as much time into this as she can. We've also got James Freed, who's the Chief Digital Information Officer and our SRO for the programme and for this review. Next slide, please, Donna. So I just wanted to share this with you because this is very much the focus of where we've started. So it's about our CNIO vision. I'm not going to read it out to you, but I wanted to include it in the slide so it's in your mind when they're given to you. But it's basically about making sure that our workforce, our nursing and midwifery workforce, have the capabilities to lead, deliver, innovate and transform services. Excuse me. Sorry, next slide please, Donna. Sorry. So why now? In 2021, the Digital Maturity Assessment, which was completed out by the CNIO's office, it highlighted there was a real variability in the makeup of digital health teams, with an emerging population of those digital health leaders in both nursing and midwifery. And they very much, in talking to them, felt they'd been passive recipients of technology and had not been part of the decision-making process. I think I was quite lucky that I was, but that's more not really the norm. This assessment identified a need to standardise and define clear education standards for that entire workforce, including our pre-reg through to those nurses who want to work as practice. So it's about being digitally enabled, so using technology to deliver care to the benefit of the people that we care for, and that's specialist through to the CNIO level. Sorry, excuse me, I'm going to have to have a drink of water. I've done a test this morning. I haven't got COVID, but I've got an awfully dry cough, so I do apologise. Holly's obviously mentioned what good looks like for nursing, which was launched at the Nursing Summit at Rewired in March. And we've included this because it's very much an operational guidance for chief nurses and directors of nursing, but obviously we can build on the discovery work from that framework. Now, I guess the main driver for this is the 2019 Eric Topol report, which focused on providing a view of digital healthcare technologies and their impact on the NHS workforce over the next 20 years. He identified a need to bridge the skills gap and future workforce pipeline, specifically highlighting that need for technical staff. Now, there was really limited focus on specific needs of the nursing and midwifery workforce, so it's really difficult to apply those findings to the nursing and midwifery profession at scale. And obviously we know the pandemic accelerated the use and adoption of digital devices and systems at a scale and pace not previously seen by our frontline health and social care staff, as well as the people that are using these services. So the focus of the Phillips Eyre review is about building upon these important documents and evidence to determine the needs of the nursing and midwifery workforce, with the approach that a nursing and midwifery voice is needed in all places, in all settings. And it's vital that we have an understanding of that current state and focus on the future digital practice and needs of our workforce. That will allow us to provide clarity on that long-term view, leading to an education plan for those things we need to do at both a national and a systemic level, so we have the workforce that we need for this transformation. Next slide, please. So the review is going to address these 4 questions, and the focus is examining the impact of those technological advances, both in the here and now, on what it means for the next 5, 10 and 20 years. So we've added at the bottom of there, we've got the considerations for inclusion, equality and diversity. It's actually not a separate question and it's not a separate theme. It's something that needs to be considered throughout so that we can have it as that golden thread running through, and we don't have to come back and go, what about those people that don't have access to devices? What about the hospitals that are still on paper? So we've got to really look and balance that out in finding out what the implications are. Now, as part of the review, we're going to ensure that people and practice are at the heart of the review. The resulting recommendations will bring together both national and international experts with expertise beyond nursing and midwifery to investigate, critically appraise and make those recommendations so that we can ensure the breadth of ambition and scope of future practice of the pre and post registration nursing and midwifery workforce is captured. Next slide please, Donna. So the focus of the review, we've got 7 key themes. Now again, you can see that they're informed by Topol. Genomics, AI and data were very much what Topol was about, so we're going to revisit those. We've also, sorry, I do apologise. What we've had to do, because we've got these 7 key themes, we've had to pull them together into panels. So we've tried to put them in a way that makes sense, so one will evidence the other. Now, obviously we realise that these are going to cross-pollinate, because from each panel we're looking at education, so all of that will move into our very much professional development focused panel. Next slide please. I'm so sorry. So, as I mentioned, this is going to revisit the total themes. We've already recognised that the pandemic has moved digital technology at pace. For instance, the TOPOL review suggested that 50% of the workforce would be using remote monitoring by 2028. Now, we believe this has already been exceeded, so we need to understand where we are to enable that to project the future adoption and progression, and also take that moment in time to see how far we've come and actually pause, look, take the lessons learned and use those to inform the future. Now, our co-chairs, we've got Professor Ruth Endicott, who's the Director of Nursing and Midwifery at the National Institute for Health Research. And we've also got Cynthia Bargemer, who is the Chief Operating Officer at the American Institute for Healthcare Improvement. Cynthia has got over 18 years experience as a Chief Operating Officer and a Chief Nursing Officer in a number of hospitals, so brings a real breadth of experience to us. Can we go to the next slide, please? So, panel 2 is all about delivering care to people wherever they are, whether that's home, in a care home, in a hospital setting, in a prison, community, social care. And we've joined it with emerging technologies so that we can support and progress that people-led care. Our international co-chair for this panel is Molly Mccarthy, who is the Chief Nursing Officer Strategist at Microsoft. Now, Molly's primary focus is business development strategy for virtual health at Microsoft, but she's got 20 years experience in the healthcare industry, including as a Chief Nursing Officer. Some of you may know Dr. Gemma Stacey, who's the Director of Academy and Deputy Chief Executive at the Florence Nightingale Foundation. And again, Gemma has got more than 20 years experience as a mental health nurse, and again is bringing a huge breadth of knowledge to the panel. Next slide, please. So, panel 3 is all about the workforce. It's about the professionalisation of the digital nurse specialist. What does our future workforce look like? Now, again, following on from TOPOL, it was suggested that the NHS digital workforce required an additional 32,000 members of staff to work in technology and data by, I think it was 2030. So as nurses and midwives, we know that new technology and electronic patient records need our input, as well as other clinical staff, so that we can ensure that those systems that come in meet the needs of the workforce, adding that benefit to both us and the people that we serve. So I guess something that might come out of that is how many nurses and midwives do we need to work with these additional IT staff to keep that pace going? Now, preparation for practice includes nurses and midwives at all levels of education, from undergraduate through to postgraduate, and that includes that advanced clinical practice. We need to understand what this means for the needs of our workforce and for those higher education institutes. Now, Dr. Jen Bichelle Findlay, she's a fellow of the Australian College of Nursing and Australasian College of Health Informatics. She's also currently the chair of I think it's the New South Wales branch of the Health Informatics Society. Now, Jen drove the capabilities and competency framework that came out of Australia and has been working in partnership with Ireland and Northern Ireland in the competencies and capabilities framework that they've just delivered. You may know Professor Laura Sarant. She's the Regional Head of Nursing at Health Education England for the North East, Yorkshire and Humber. She's also a Professor of Nursing in the Faculty of Health and Wellbeing at Sheffield Hallam University. And again, Laura is going to bring a huge amount of experience to this. Next slide, please, Donna. So, why is this important? And I guess it meets the CNIO's aims, which we alluded to in the vision at the beginning, making sure that we're all empowered to practice and lead in a digitally enabled health and social care system, both now and in the future, to ensure that nursing and midwifery practice is fully supported by the use of digital technology and data science, so it supports what we're doing. We have the opportunities to innovate and transform, and it isn't a blocker to what we're trying to do. Next slide, please, Donna. So I just wanted to briefly share with you a really high-level review timeline so you know what we're working towards. And as you can see, we're really moving at pace. So we've our panels have all met. We've done the literature reviews. We've made sure our panels are core and have the right members. We're doing a series of evidence gathering, which will include roundtables. So if you're attending the Digital Health Summer School in York next week, please have a look, because we're running a roundtable on the Friday afternoon. There will be one roundtable a week that will be focused on the themes that are being investigated by the panels up to, I think it's the first week of September. We will be taking the findings of those to inform an interim report, which will give those interim findings and recommendations, and this will go out for a period of consultation. Now, the plan is currently that will be launched at the Ruth May's Chief Nursing Officer Summit at the end of September. We've got a 6-week period of consultation. We will then take the findings back from that, do a final report, which will be circulated for system-wide engagement at the beginning of next year, and then it will be launched at the CNO Summit in May. Now, the slight difference between our nursing and midwifery review, one of the bigger differences between the nursing and midwifery review and the TOPOL review, is that when TOPOL was delivered, it was delivered as a set of recommendations and then it stopped. It drove some work, so it drives the work of the digital readiness education team and other things, but there was no plan. What we're going to be doing is, once we have that sort of final draft in January, we will be taking that set of recommendations and putting a proposed roadmap and strategy together, what needs to be done over the next 5-year period. Now, the reason I say proposed is because I'm always aware I don't hold any budgets. So we'll be putting that strategic roadmap together, and then it will go to the arms-led bodies and the centres to then action. The next slide, please, Donna, and you'll be pleased to know that this is my last slide. So we're happy to take questions, but I have an ask from you, and it's about that evidence gathering piece. So what we've got there is we've got the QR code, which will allow you to register an expression of interest to be involved in either the roundtables. We're doing one-to-one interviews. Now, at the moment, we've had 220 expressions of interest across a breadth of professions and care settings, and that's how we're driving this. This isn't something that we just want to hear from nurses and midwives. We want to hear from every profession in every setting, including independent providers and tech companies, so that we can understand the breadth of what we're looking at. We don't want to do it, we don't talk about silos. Somebody said to me, it's a cylinder of excellence. We don't want to do it within that cylinder of excellence. We want to make sure that we have everybody with every view and every profession involved. And one of the key ideas of that is, although we're doing a nursing and midwifery review, we want it to be done in such a way that if it's informed across professions, then other professions will be able to pick it up and adapt it if needed, rather than every profession doing their own review. If we keep the patient at the centre, which we're doing, we have patient representatives on the panels and they're going to be invited to the round tables, is that we can make it focused so that, as I say, it can be adaptable and it can be scaled and spread across. So what we're asking you to do is submit an expression of interest, join those roundtable events, participate in the consultation that will happen in October and November. I've shared the link to the Phillips Ives Review website there, and as I mentioned, that's the expression of interest for the EOI. Now, the only other thing I would say, because we have a large number of expressions of interest, we know that not everybody is going to be interviewed or join the roundtable. So what we're also going to do is produce a survey that will replicate the questions that would be asked in interview, so that absolutely anybody who wants to submit an opinion, case studies or evidence has the ability to do so. This needs to be owned by us as a workforce. It's the only way we can drive it forward, and we really want to get this right, so it's really important that we get your involvement. And that's my last slide. I think we're almost on top of it.